for natural healing. Gonna wait a few minutes, see who jumps on. If you guys are joining, please let me know if you can hear me. We're gonna wait a few minutes. So hopefully you guys are enjoying the weather and hopefully it's kind of nice out. It was not supposed to rain today and it rained a little bit, but yeah. Anyway, so yeah, if you can say hi, let me know if you guys can hear me okay. Shout out to where you're listening from. Again, we're in the Chicagoland area. So would love to hear from where you guys are at. So thank you for joining. So we're going to talk tonight a little bit about Lyme and Lyme co-infection. So first off, what is a co-infection? Co-infection is when a host, like a bug, carries a whole bunch of bacteria, not just one. And most of the time, it's very similar bacterium, or it's usually the same type of things. So Lyme is from a bacterium called Borrelia. Oh, you're from the Sunshine State. Thanks for joining. Hi. So, oh, it's my friend Judy. So, thank you, Judy. Thank you for saying hi. So, how's the weather down there? Hopefully it's nice. So, and you guys have all the warm, sunny weather, and hopefully it's not too bad down there. So send some sun up this way. It was actually sunny yesterday, but today it was supposed to be a little bit windy and not rain, and there we had some rain up here. So anyway, so co-infection of Lyme. Um, so Borrelia is the actual bacterium for Lyme, and there are some co-infections. So Bartonella is a bacterium that's often seen with Lyme disease, and Bartonella is a bacterium that actually acts like a parasite. So it's a bacterium that has to live inside of a cell in order to survive. Babesia is another co-infection for Lyme, and that is an actual microscopic parasite. Okay. So, where can we get Lyme disease? Well, quite honestly, we can get Lyme from any biting insect. You don't have to have just tick bite to get Lyme disease. Any biting insect can cause it. So, mosquitoes, spiders, like I said, any biting insect. You don't necessarily have to get the high fever and the bullseye rash. Okay. So, what are some common symptoms? Are any of you guys suffering from chronic headaches, frequent headaches, bad headaches, migraines? Okay, that can be from Lyme. Loss of hearing, okay? Thyroid issues, because Lyme can cause hormonal disruption. So I had a patient, um, she was actually having really bad fibroids. And she actually had a couple things going on. Lyme was one of them, but she also had parasites in her uterus causing the fibroids and things like that. But she had severe bleeding. And she was a patient of mine, and she had gone like I think I was seeing her like once every couple months or something like that. She was actually doing really well. I didn't need to see her that often. And she went on vacation. She went to like a cabin in the woods and with her family. And if I remember the story correctly, I might have it a little bit mixed up, but roughly she was out, she was like in nature, you know, doing something, and she got bit up by a whole bunch of mosquitoes. And that was like the previous month. Now I was only seeing her every couple months, just kind of for maintenance and routine checkups here and there and stuff like that with muscle testing and to see how everything was going. So I wasn't seeing her that often. And she wound up like on her next period, she wound up having severe bleeding to the point where it literally wasn't stopping. And she was bleeding by the time she actually called to come in to see me. She had been bleeding for over 2 weeks straight and lots of it to the point where her doctor was considering on doing a hysterectomy because they couldn't get it under control. And we did some muscle testing, and she actually had Lyme. I think she had, don't quote me because I can't, because this was over a year and a half ago and I don't have her information up in front and whatnot, but it was Borrelia and either Babesia or Bartonella. She had the actual Lyme and one of its co-infections, or maybe both. I'm not exactly sure which. And so I was muscle testing her, and we started her on supplements, and within a day or two, the bleeding decreased, and by a couple days, it had stopped. Big, huge difference. And just in a matter of a couple days. Now, her body was also used to detoxing. It was fairly healthy by this point, but this is how severe like Lyme can actually, what some of the symptoms it can cause. So it can cause like hormonal disruption. It can attack your reproductive organs, okay? You can wind up with thyroid issues. You can wind up with heart complications, severe joint issues like joint pain and stiffness. Most of my patients that have like unexplained back pain, or even if they have arthritis, they wind up testing at some point for Lyme or its co-infection. Plantar fasciitis can actually be from Lyme or its co-infection. Okay. So, nausea and vomiting. So, gut issues. These can actually be from Lyme or its co-infection. Paralysis of the face. Okay. So you can't control any of your muscles, or it's like stuck in position, so it's paralyzed. Okay. So that can be from Lyme as well. So, well, I've had Lyme tests, Tracy. Why does it come back negative? Because I thought my symptoms were Lyme, but it comes back negative. Let me explain a little bit about that. So in traditional Western testing, you test for Lyme antibodies, and pretty much you're only testing for Borrelia, not its co-infections. You can have Bartonella and Babesia without having Borrelia, so the actual true Lyme, and you can have similar symptoms. Okay, so when we do traditional testing, we're testing for the antibodies. Sometimes you can get infected and never produce antibodies. So when we do the blood work and we're looking for antibodies, you don't have them. Doesn't mean that you were not exposed to Lyme or that you don't have Lyme. You just never produced the antibodies for the Lyme disease. Or it's been so long that your antibodies run out. Just because you run out of antibodies, maybe you did have them and you didn't think all these new symptoms were related. And then it's like, oh, I read something and it might be Lyme. And now you test for it and it's been a couple years. Maybe now you don't have the antibodies or whatever. So does that mean that you don't have the bacterium anymore or whatever? No, it just means that you ran out of antibodies. So this is where, some things can actually get missed by Western medicine. This is why I like muscle testing so well. And again, what we want to do is we want to find out the underlying cause of why you have your symptoms. So almost every single person that I see that has chronic joint pain, stiff knees, back pain, hip pain, plantar fasciitis, they actually have Lyme. And we use several different things to help people get rid of their Lyme disease. We use a company called Cellcore. They have some great supplements, particularly, let's see if I have one. Oh, I love this one. So this one is called Isbor. So I love this one. It has sweet wormwood leaf, Japanese knotweed root. It's got milk thistle in there, wormwood leaf, burdock, black walnut hull, teasel root, yellow dock root, devil's claw. It's got turmeric, white willow bark, eleuthero root, boneseed stem and leaf, sheep sorrel stem and leaf, cat's claw bark, horsetail stem and leaf, uh, cranesbill root, hawthorn berry, buckthorn bark, stinging nettle, Poda arco, astragalus, slippery elm. All these are freaking amazing herbs. And in the right combination, they have things that will help support the immune system to get rid of Lyme or its co-infection. And a lot of these have other fantastic benefits. Anti-inflammatory, helps your cardiovascular, helps your kidneys, helps support so many different parts of your body. So a lot of times when you take whole food or herbal supplements, they not only just help with one thing, but they can help with multitude parts of your body and support many different organs and many different areas. So you're getting a whole body effect and supporting many different parts of your body at once. And what I love about muscle testing is in quantum nutrition testing is we can assess exactly which supplements, because there's other supplements other than Isbor that we use. I love this company from Systemic Formulas. They're one of their products called VV is really good. I love their product called Backtricks, which is really good too. And so what's nice about muscle testing is that we can find out specifically what supplements your body wants rather than guessing or putting everybody into a box and saying, "Oh, everybody who has Lyme should take these supplements and this dose, and that's it." Well, that's not how that really works because your body is different from your neighbors. It's different from your kids. It's different from your parents. It's different from the stranger down the street. So why would you want to put yourself into a box and into a protocol? Okay. Protocols can be okay, I'm not saying whoever does it, it's better than not doing anything, but I would rather do something that my body wants. What does my body want? How much does it want? Does it want what the bottle says? Or does it want less or more? How many times have you guys like have taken a supplement and you're just like, well, I thought it didn't really do anything. And I added extra and now I finally feel better. That's because your body wanted more than what the bottle actually said. And that's okay. And sometimes that can happen where your body wants more or less of what the bottle actually says. And that's what I love about muscle testing too. There's a way for us to actually figure out how much your body needs and what combination of supplements your body needs. Maybe one person only wants Isbor, while maybe somebody else wants 2 or 3 different supplements to get rid of the Lyme or the Lyme co-infection. Each person's slightly different, and that's what's so unique about this. So we can find out like what organs are being affected even if you have normal labs. So how many times have you guys like feel horrible and the doctor says, "I don't know what's wrong with you. Your labs look great." And you're like, "No, I know that something's wrong. I'm anxious all the time, or I can't sleep, or I'm tired all the time." Doctor goes, "Oh, here, well, then take this pill." Okay, great. You have anxiety. Oh, here, have a pill. You can't sleep at night. Here, have a sleeping pill. You're just like, okay, that might help me sleep, but why can I not sleep? What is the cause? Are you just giving me a Band-Aid with a whole bunch of side effects to begin with? Or are you actually fixing the underlying cause? Western medicine doesn't do that a lot of times. It just turns around and gives you a Band-Aid with serious side effects to it too. So again, going back to the Lyme and Lyme co-infection, most people, a lot of people with any type of joint pain or inflammation have Lyme or its co-infection and it's being missed. If you have headaches, if you have joint pain and inflammation, if you have hormonal imbalances, if you have wonky periods, okay, there's a good chance you have Lyme disease. Okay. If you have brain fog, like you kind of feel spaced out half of the time, chances are you have Lyme. If you don't have that and spring is coming, so bugs are going to be coming out pretty soon, and all of a sudden you start feeling that towards the end of the summer or even in the middle of the summer, you might have gotten bit by a bug, not just necessarily a tick, but you might have gotten bit by a bug who has Lyme or Lyme co-infection. Let's get to the root cause of why you have your symptoms. Okay. So there is help for that. And you don't, and it can be natural too. Um, so yeah, if you want more information, if you want to find out how we can muscle test, we actually have virtual and in-person appointments. So no matter where you're at, we can help. We have patients across the country. Give us a call. Would love to answer any of your questions. And if you don't even want to call me, then, at least find a good functional homeopathic or naturopath that's in your area that can help you naturally. All right. Otherwise, give us a call 708-554-6730. Have a wonderful night, guys. Oops.